A silent threat is growing inside hospitals. It's not a new virus, but a powerful bacteria that even the strongest antibiotics struggle to stop. According to the CDC, a dangerous drug-resistant infection called NDMCRE has surged in the United States, and its rise could change how medicine fights infections forever. The alarming numbers. In 2020, during the height of the COVID-19 pandemic, the CDC released a special report titled COVID-19: U.S. Impact on Antimicrobial Resistance. That report estimated that about 12,700 infections and 1,100 deaths in the U.S. were caused by carbapenem-resistant Enterobacterales, or CRE. These bacteria were already considered some of the toughest infections to treat. Fast forward a few years, and things have only gotten worse. Between 2019 and 2023, infections caused specifically by NDM, producing carbapenem-resistant Enterobacterales, known as NDMCRE, rose by more than 460%. This is not a small uptick. It is a dramatic surge that highlights just how quickly this dangerous bacteria is spreading in healthcare settings. These infections don't just affect one part of the body. NDMCRE has been found to cause pneumonia, bloodstream infections, urinary tract infections, and even wound infections. Each of these can become deadly, especially in vulnerable patients. Why detection is so difficult? One of the most troubling details is that many hospitals and clinics are not even equipped to detect NDMCRE quickly. Clinical laboratories often lack the tools needed to identify this specific type of resistance. That means a patient can be infected with NDMCRE, but doctors may not realize it in time. Danielle Rankin, an epidemiologist in CDC's Division of Healthcare Quality Promotion, explained just how complicated this situation has become. She said, "This sharp rise in NDMCRE means we face a growing threat that limits our ability to treat some of the most serious bacterial infections. Selecting the right treatment has never been more complicated, so it is vitally important that healthcare providers have access to testing to help them select the proper targeted therapies. Without proper testing, patients risk being treated with antibiotics that simply won't work, giving the infection more time to spread and become life-threatening." What exactly is NDMCRE? So, what makes NDMCRE different from other forms of CRE? First, CRE itself stands for carbapenem-resistant Enterobacterales. This group of bacteria is resistant to carbapenems, which are some of the strongest antibiotics available today. Doctors typically reserve carbapenems as a last resort, used when nothing else works. NDM refers to New Delhi metallobeta-lactamase, an enzyme that makes these bacteria resistant to nearly all available antibiotics. When bacteria produce NDM, they can neutralize most treatments, leaving very few effective options. For patients, this often means longer hospital stays, more complications, and in too many cases, death. Why this matters to patients? NDMCRE isn't just another medical acronym. For patients, it represents one of the scariest infections you can get. These bacteria are linked with high rates of morbidity and mortality. That means patients who develop NDMCRE often face severe illness, and many do not survive. What makes it worse is how easily it can go unrecognized. Because NDMCRE has historically been rare in the US, many doctors may not immediately suspect it when they see a case of CRE. This delay in suspicion and treatment gives the bacteria even more time to cause damage, but the risk isn't limited to hospitals. Without strict infection prevention measures, NDMCRE can spread rapidly through healthcare systems, from one patient to another, and even into the broader community. What the CDC urges healthcare providers to do. Because of these dangers, the CDC is urging healthcare providers to take several important steps. First, they need to stay informed. NDMCRE is no longer an uncommon infection in the United States, and doctors need to understand what's happening nationally and locally to be prepared. The second step is prompt testing. When a CRE infection is identified, it's vital to test for the exact type of carbapenemase, including whether NDM is involved. While not every hospital has the technology, many public health laboratories can provide this testing support. The third step is careful treatment selection. Doctors cannot rely on broad approaches anymore. They must understand which resistance mechanism is driving the infection to choose the right antibiotic if one is available. And finally, prevention is critical. The CDC advises strict adherence to infection prevention guidelines. That includes wearing gowns and gloves when caring for infected patients, using contact precautions in acute care hospitals, and enhanced barrier precautions in long-term care facilities. Hospitals are also encouraged to work with local healthcare-associated infections and antimicrobial resistance programs, often called HAI/AR programs, to stop the spread before outbreaks occur. Who is most at risk? The people at greatest risk for NDMCRE infections are often those already dealing with other health challenges. Hospitalized patients, especially those in intensive care units, are vulnerable because they may be on ventilators, have catheters, or open wounds. These devices provide entry points for bacteria. Older adults, particularly those in long-term care facilities, are also at higher risk. Their immune systems may already be weaker, and infection prevention in these settings is more difficult because of frequent patient movement and shared resources. Patients who need frequent or prolonged courses of antibiotics are another group at risk. The more often antibiotics are used, the more chances bacteria have to adapt and resist. Why this cannot be ignored? Danielle Rankin's warning makes it clear. The rise of NDMCRE is not just a technical issue for laboratories, it's a life and death matter for patients. Testing, prevention, and careful treatment choices are the only way to slow the spread. For healthcare providers, this means adapting quickly. For patients and families, it means asking the right questions about infection prevention when receiving care. The CDC's report in the Annals of Internal Medicine is more than just a publication. It's a wake-up call. Infections that resist nearly all antibiotics are no longer rare. They're rising fast, and they pose a real danger to patients across the country. But the story is still unfolding. Will stronger testing, tighter infection control, and better awareness slow the surge? Let us know your thoughts in the comments. Would you survive this situation?